This is the Perel move. Don't open with the organ, open with the betrayal of trust. She'd say something like, we spent years pointing at one thing, blaming it, avoiding it, feeling righteous every time we skipped it, and the whole time something else was quietly doing the real damage. In a place that never complains until it's nearly too late, your liver doesn't ache. It doesn't warn you the way a headache or a cramp does. It just keeps absorbing the hit silently, loyally for years while you were busy watching the wrong door. Try. We taught an entire generation to fear one ingredient so completely that everything else got a free pass, and the organ paying the price for that misplaced trust doesn't even have the nerve endings to tell you it's struggling size until the damage is already done. Then pivot into naming what's actually driving it. This works because it reframes liver disease not as a nutrition fact, but as a story about misdirected suspicion. The audience feels implicated. I trusted the wrong thing too, which is far stickier than a straightforward health warning. It turns a biology lesson into a quiet accusation. You've been guarding the wrong door. I want to start with a confession that isn't mine. It's yours, whether you realize it or not. For years, you've been trusting the wrong organ to protect itself the way every other part of your body does. You cut yourself, you feel it. You strain a muscle, you feel it. So somewhere along the way, you assumed your liver would do the same thing, that if something were truly wrong, you'd know. You'd feel it, your body would tell you it won't, and that single quiet assumption may be the most dangerous thing in this room today. Your liver has almost no pain receptors. It can be under real measurable distress, accumulating fat, inflamed, scarring, while you feel completely fine. Go to work, eat dinner, laugh with your kids, feel by every measure available to you perfectly healthy, while one of the most important organs in your body is quietly losing a battle nobody told you it was fighting. And here's what makes this even harder to accept. We were taught to watch one door, sugar, cut the soda, skip the dessert, feel like you'd done the responsible thing and move on. But an entire generation did exactly that, genuinely cleaned up their sugar, for sugar, and their livers kept struggling anyway, because sugar was never the whole story. It was simply the easiest villain to name, while something else, several somethings in fact, walked quietly past the door we were all watching. In the next few minutes, I'm going to show you what's actually been driving this, the causes almost nobody connects, the assumptions that have kept people from ever thinking to ask, and exactly what you can do, starting today before your liver ever has to force the issue. This organ has never once asked you for anything. Today, we finally return the favor. So I want to start with something most of you have probably never thought about, and once I explain it, you're going to understand exactly why this organ can fail so quietly, so completely, without a single warning sign along the way. Your liver has almost no pain receptors. Think about what that actually means. Cut your finger and you know instantly. Pull a muscle and your body tells you immediately, insistently until you rest it. But your liver can be under real measurable distress, inflamed, scarring, accumulating fat cell by cell, and send you almost nothing. No ache, no twinge, no signal telling you to stop, to change something, to pay attention. It simply absorbs the damage silently for years, sometimes decades before it ever announces itself. And this is precisely why fatty liver disease has become what doctors are now calling a silent epidemic. Not silent because it's rare. It is nowhere close to rare. It now affects a staggering share of American adults. Copper. But silent in the most literal sense, silent inside the body of the person living with it. You can have a liver that is 30, 40, 50% fat infiltrated, functioning under real strain, actively progressing towards scarring, and feel completely normal. Go to work, exercise, eat dinner with your family, feel by every subjective measure available to you perfectly fine, while one of the most important organs in your body is quietly losing ground. And here's the part that should really unsettle you, because there's no pain to prompt a doctor's visit, because there's no symptom pushing you toward a diagnosis. The disease is very often caught by accident. Someone goes in for an unrelated checkup, a routine blood panel comes back with slightly elevated liver enzymes, and only then does anyone start asking questions. Or worse, it isn't caught at all until the damage has already progressed from simple fat accumulation into inflammation, and from inflammation into scarring, a process called fibrosis, which can eventually progress into cirrhosis. By the time symptoms actually show up, fatigue, abdominal discomfort, jaundice in advanced cases, the liver has often already sustained damage that took years to build and cannot always be fully reversed. I want you to sit with the scale of this for a second, because I don't think most people have any idea how widespread it's become. We are talking about a condition that now affects somewhere in the range of 1 in 3 American adults in some form. 1 in 3. Not a rare diagnosis reserved for a small, unlucky group. A condition quietly present in an enormous share of the people sitting in this room, in your family, in your circle of friends, most of whom have absolutely no idea, because the one organ capable of telling them early never got the chance. This is exactly why I wanted to open here before we get into any of the the specific causes before we talk about what's actually driving this at a scale nobody warned you about. Because I think most people approach their health by waiting for their body to tell them something is wrong. And that strategy, when it comes to your liver, simply does not work. Your liver was never going to raise the alarm in time. It doesn't have the wiring for it, which means the responsibility shifts entirely, not to noticing symptoms because there often aren't any, but to understanding ahead of time what actually puts this organ at risk, so you're not relying on pain that may never come to tell you when it's already too late. So before we go any further, before we talk about what's really behind this epidemic, before we dismantle the assumption that this is only a drinker's disease, I need this fact to land first. The organ working hardest to protect you, filtering everything you eat and drink, metabolizing every gram of what enters your body, is also the one organ least equipped to ask for help when it's struggling. It doesn't complain, it doesn't warn you, it simply keeps working silently for as long as it possibly can. Your liver has been quietly absorbing the cost of decisions it never got a vote in. And it will keep doing that without a single complaint for exactly as long as you let it. Now, some of you who've heard me talk about sugar before are probably sitting there a little confused right now, wondering if I'm about to contradict everything I've said in the past. I'm not. Sugar's role in liver disease is real, it's significant, and the biochemistry behind it, fructose metabolized almost identically to alcohol, converted directly into fat inside the liver. That mechanism hasn't changed, and I stand by every word of it. But I need to be honest with you about something today, because I think the conversation around sugar, as important as it is, has let a lot of other genuine contributors quietly slip past unexamined. Here's what happened as I see it. Sugar became the villain, and it became the villain quickly because it's an easy story to tell. It's a single ingredient. You can point to it, name it, avoid it, feel a sense of control over it, cut the soda, skip the dessert, and you've done something concrete, something measurable, something that feels like real action. That's a satisfying narrative, and a lot of it is genuinely deserved. But the moment a single villain becomes the entire story, everything else operating alongside it gets a quiet pass. And I think that's exactly what's happened here. Sugar absorbed so much of the blame, so much of the public attention, that people walked away assuming if they simply cut back on sugar, their liver was safe. That assumption is not accurate, and I think it may be doing real harm because it's given people a false sense of having solved a problem that, for many of them, is still very much in progress. Think about it from a purely logical standpoint. If sugar were the sole driver of this epidemic, we would expect fatty liver disease to track fairly closely with sugar consumption trends, and to some degree it does. But we are also seeing rising rates of liver disease in people who have genuinely cleaned up their sugar intake, people who cut soda, who watch their dessert habits, who feel reasonably like they've done the responsible thing, and yet their liver panels are still coming back concerning. And that gap between I fixed the thing I was told to fix and my liver is still struggling is exactly where the rest of this conversation needs to live. Because if sugar alone explained everything, that gap wouldn't exist. It does exist, which tells us something else is very much still in play. I want to be clear about why this matters so much, beyond just getting the science right. When you give people a single villain and they defeat that villain, they stop looking. They stop asking questions. They assume the danger has passed because the one thing they were told to fear is now under control. That's a dangerous place to land, especially for an organ that, as we just talked about, isn't going to tell you if something's still wrong. If you've cut your sugar and you're feeling confident, your liver's protected, but there's an entire category of contributors nobody warned you about still quietly working against you. That confidence isn't protecting you. It's actually leaving you more exposed because it's replaced vigilance with a false sense of completion. So I want to reframe how we think about this, going into everything else we're going to cover today. Sugar is a real contributor. It's not a myth and it's not off the hook, but it was never the entire picture, and treating it as though it were has let some genuinely significant factors operate almost entirely outside the public conversation. Factors that in some cases may be doing just as much damage quietly to people who feel like they've already done everything right. This is exactly why I think it's time to widen the lens. Not to let sugar off the hook, but to stop letting it serve as a shield for everything else that's been standing quietly behind it this entire time. You didn't get the full story before. Today you're going to. And let's talk about something that's been sitting in almost every kitchen in America, in nearly every restaurant meal, in the vast majority of packaged food you've eaten this week, and that almost nobody thinks to question because it's been marketed to us for decades as the responsible choice. Vegetable oil, canola oil, soybean oil, corn oil, the seed oils, the ones sitting in the heart-healthy section of your pantry, the ones that replace butter and lard because we were told for years that they were the safer alternative. I want to walk you through why a growing number of researchers are looking much more closely at this category and why I think it deserves a seat at this table today. Here's the story briefly because context matters. Decades ago, as saturated fat was being cast as public enemy number one, A narrative we now know was shaped in part by an industry with its own financial interests. Highly refined seed oil stepped in as the recommended replacement. Cheap to produce, shelf-stable, and marketed heavily as the heart-healthy choice, they flooded the food supply almost overnight. Today, these oils make up a genuinely enormous share of the fat Americans consume, not just from the bottle in your pantry, but hidden inside packaged foods, fried foods, sauces, and dressings, quietly present in a huge percentage of what people eat in a given day, often without them ever choosing it directly. Now, here's where the liver comes back into this conversation. These oils are extremely high in a particular type of fat, omega-6 polyunsaturated fat, and while your body does need some omega-6, the ratio matters enormously. Historically, human diets contained omega-6 and omega-3 fats in a fairly balanced ratio. Today, with seed oils saturating the food supply, that ratio has shifted dramatically. Some researchers estimating it's become 15-20 times more skewed toward omega-6 than what our bodies evolved to handle. And emerging research is starting to connect that imbalance to increased inflammation throughout the body. Inflammation that doesn't stay contained to wherever it starts, but circulates, including through the liver, an organ that sits directly in the path of nearly everything you consume, processing it, filtering it, absorbing the consequences of it. When these highly refined oils are combined with the ultra-processed food we've already talked about, because that's usually exactly where they show up, frying oil in fast food, the base of a bottled salad dressing, the fat in a packaged snacky, you get a compounding effect. The liver isn't just dealing with sugar anymore. It's dealing with a steady, chronic influx of oxidized, heavily processed fats layered directly on top of everything else, at a scale the human liver has never had to process across our entire evolutionary history. Some researchers looking specifically at fatty liver disease progression are now examining whether this combination, industrial seed oils plus processed carbohydrates, may be driving inflammation and fat accumulation in the liver, even in people who've genuinely cut back on sugar, which would explain exactly the gap we talked about a moment ago. I want to be careful here because this is an area where the research is still evolving, and I'm not going to stand up here and tell you it's as settled as the sugar-liver connection, because it isn't, not yet. But I think that's exactly why it deserves more attention than it's getting, not less. We spent years building an entire public health narrative around one villain, sugar, while a different category of ingredient, quietly reformulated into nearly everything on the shelf, marketed the entire time as the responsible, heart-healthy choice, was expanding into nearly every corner of the American diet, almost entirely unquestioned. So here's what I want you to start doing, even while the research continues to develop. Start looking at what oil is actually being used in your kitchen and on the ingredient list of the packaged food you buy. Because the ingredient wearing the health halo in this story isn't dessert. It's the bottle sitting quietly next to the stove, doing far more work on your liver than anyone ever told you to watch for. In Sapichu, what for? I want to clear up something that I think is doing genuine harm because it's kept an enormous number of people from ever taking their liver seriously in the first place. Say the words liver disease to almost anyone and watch what happens in their mind. They picture a heavy drinker, decades of alcohol, a very specific kind of damage, a very specific kind of person. And if that's not you, if you rarely drink or don't drink at all, you file liver disease under not my problem and move on with your day. I understand exactly why that assumption exists. For most of medical history, it was largely true, but it is no longer true, and the gap between what people believe and what's actually happening has become one of the most dangerous blind spots in modern health. The condition affecting such a staggering share of American adults right now has an actual clinical name, and the name itself tells you everything you need to know. Non-alcoholic fatty liver disease. Non-alcoholic. Doctors had to build that word directly into the diagnosis, specifically because so many patients were showing up with livers that looked under imaging almost identical to what you'd see in a long-time heavy drinker, fat accumulation, inflammation, in advanced cases scarring, and despite these patients having little to no meaningful alcohol consumption at all. The liver doesn't actually care what caused the fat buildup. Alcohol produces a certain metabolic pathway toward liver fat. But so it turns out, does a diet heavy in refined carbohydrates, excess fructose, industrial fats, and chronic caloric surplus, especially layered on top of insulin resistance. Different starting point, strikingly similar destination. Think about what that actually means for how wrong our mental model has been. We built an entire cultural understanding of liver disease around a single cause when the organ itself is being damaged by a much wider set of inputs, most of which have nothing to do with alcohol at all. A person who has never had a drink in their life can develop a liver disease that looks on a scan almost identical to cirrhosis from decades of alcoholism, not because their liver responds differently, Because a liver under chronic metabolic stress, regardless of the source of that stress, tends to fail in remarkably similar ways. And here's what makes this particularly dangerous, tying directly back to what we already established. Because people assume liver disease is an alcohol problem, and because they know they don't have an alcohol problem, they never think to ask about their liver at all. They never request the blood work. They never think twice about that vague fatigue or that slight tenderness under their right ribs, because in their mental model, that simply isn't a category of concern that applies to them. The single biggest risk factor for this disease isn't a specific food or a specific ingredient. It's the assumption that it can't be you. I've had patients who are successful, health-conscious, people who exercise regularly, people who would never in a million years describe themselves as heavy drinkers, sit across from me stunned, genuinely stunned at a fatty liver diagnosis because everything they'd ever been taught told them this was someone else's disease. And by the time it's caught, because nobody was looking for it, because nobody thought to look, it's often further along than anyone would like. This is exactly why I need you to let go of the old mental model completely right now today. Stop asking yourself, do I drink enough for this to be a concern? That question is no longer the right one. The right question is a completely different one. Is my metabolic health broadly, my blood sugar, my weight, my activity level, my diet, putting chronic stress on an organ that will absorb that stress silently for years, regardless of whether alcohol was ever involved? Your liver was never only vulnerable to what you drink, it has always been vulnerable to everything you consume, everything your metabolism struggles to keep pace with, every chronic imbalance you've been quietly asking it to absorb on your behalf. The name of the disease had to include the word non-alcoholic because so many people like you were showing up with it. Don't let the old assumption be the reason you never thought to ask. Now, I want to walk through a set of contributors that almost never get mentioned in the same breath, even though put together they're doing more quiet damage to more people's livers than almost anything we've discussed so far. Not because they're exotic or rare, but because they're so ordinary, so woven into daily life that nobody thinks to connect them to an organ sitting quietly in the upper right side of your abdomen, absorbing the consequences of all of it at once. Let's start with something sitting in almost every medicine cabinet in this country. Acetaminophen, the active ingredient in one of the most common over-the-counter pain relievers on earth, is processed almost entirely through the liver. Taken as directed occasionally for a headache or a fever, it's genuinely safe for the overwhelming majority of people. But taken more often than people realize, stacked across multiple products without anyone noticing because it's hiding in cold medicine and flu remedies and combination pain relievers and products people would never think to associate with the same active ingredient. The cumulative load on the liver adds up in a way most people have never been warned about. This isn't a call to panic over an occasional dose. It's a call to actually read labels to know what you're layering on top of an organ that's often already working overtime on everything else we've discussed today. Then there's inactivity, and I want to be specific about why this matters for your liver directly, not just your waistline in general. Muscle tissue is one of the primary places your body disposes of excess blood sugar. When you're sedentary, sitting for the majority of your day, rarely engaging in the kind of movement that meaningfully uses your muscles, that glucose has fewer places to go, and a significant portion of it gets redirected toward fat storage, including disproportionately fat storage in and around the liver. This is precisely why exercise, even the low-impact, joint-friendly kind we've talked about before, does something for your liver specifically, not just your general fitness. It's giving that excess fuel somewhere else to go before your liver becomes the default destination for it. Sleep is the next piece, and it's one I think gets dismissed constantly, treated as a lifestyle nicety rather than a genuine metabolic intervention. Poor sleep, chronic short sleep, disrupted sleep, all of it measurably worsens insulin sensitivity. Your body becomes less efficient at managing blood sugar after even a handful of nights of inadequate rest, and less efficient blood sugar management means more of that sugar gets shuttled toward fat storage, again disproportionately affecting the liver. People will overhaul their entire diet and completely ignore the fact that they're running on 5 hours of sleep a night, not realizing that the sleep deficit alone may be actively undermining every dietary change they're making. And then there's the factor that ties nearly everything together. Visceral fat, the fat stored deep around your abdominal organs, distinct from the fat just under your skin. Visceral fat isn't inert. It's metabolically active tissue, releasing inflammatory compounds directly into the bloodstream that flows straight through your liver. The more visceral fat someone carries, the more inflammatory signaling their liver is chronically exposed to, independent of what they ate for breakfast that morning. This is why waist circumference tends to be a far better early predictor of liver risk than body weight alone. Two people can weigh the exact same amount, and the one carrying more fat around their midsection is very often carrying meaningfully more liver risk, regardless of what the scale says says. Here's why I wanted to bring all of this together in one place, because I don't think anyone has ever laid it out for most of you as a single connected picture. A common medication taken a little too often, a sedentary stretch of years, a chronic sleep deficit nobody addressed, a little extra weight sitting in exactly the wrong place. None of these on their own sound alarming. None of them come with a warning label connecting them to your liver specifically, but layered together quietly over years, they add up to exactly the kind of chronic burden a silent organ absorbs without ever telling you it's struggling. Nobody warned you these were connected. Today, you know. And now the question isn't whether any one of these applies to you. It's how many of them have been quietly stacking up together the entire time. So let's bring this all together into something you can actually act on, because I don't want anyone leaving here today feeling overwhelmed by everything we've just covered. I want you leaving with a short, clear list of things you can start doing this week. None of them extreme, none of them requiring you to overhaul your entire life overnight. All of them aimed directly at protecting an organ that has been quietly absorbing far more than any of us realized. Start with the liquid sugar, because if you remember nothing else from everything we've discussed, remember this. Your liver processes fructose differently than almost anything else you eat, converting a significant portion of it directly into fat, and it does that fastest and hardest when the fructose arrives in liquid form with no fiber slowing it down. Soda, sweetened coffee drinks, juice, these remain some of the single heaviest hitters for liver fat accumulation that exist in the modern diet. You don't need to eliminate sugar from your life entirely. But if there's one category to genuinely minimize starting today, it's this one. Next, take an honest look at the oil situation, both in your own kitchen and in the packaged foods you're buying. You don't need to become obsessive about it, checking every label with a magnifying glass. But start noticing. Swap the everyday cooking oil in your own kitchen towards something less industrially processed, where you reasonably can eat olive oil, avocado oil, and start paying attention to how often heavily refined seed oils show up in the packaged and fried foods that make up your week. Small shifts repeated consistently matter more here than any single dramatic change. Move your body, and I want to be very specific about why this point belongs here, rather than being treated as separate generic advice. This isn't about burning calories for the sake of a number on a scale. This is about giving your muscles somewhere to send excess blood sugar before your liver becomes the default storage site for it. And this is exactly why something like the low-impact, sustainable movement we've talked about before, a daily walk, an incline session, anything that gets your body using glucose consistently rather than sitting idle for the majority of your waking hours, does real measurable work for your liver specifically, not just your general fitness. Protect your sleep like it's a medical intervention, because in every meaningful sense, it is one. Prioritizing 7 to 8 hours consistently isn't indulgence. It's one of the most direct levers you have over your own insulin sensitivity, and by extension over how much excess sugar your body redirects toward liver fat storage every single day. If you're overhauling your diet while ignoring chronic sleep deprivation, you are quite literally undermining your own effort with one hand while trying to fix it with the other. And finally, I want to give you something concrete to actually do, not just think about. The next time you're at your doctor's office, ask for a liver panel to be included in your routine blood work. This is a simple request, often just a couple of additional markers on a blood test you may already be getting. It is not invasive, it is not expensive, and for an organ that we've established will not tell you when something is wrong, a periodic liver panel is one of the only ways to actually know ahead of any symptom ever showing up, whether things are trending in the right direction or not. Don't wait for your doctor to think of it. Ask for it yourself. I want you to notice something about every single one of these 5 steps. None of them are punishing. None of them require deprivation or extreme discipline or turning your entire life upside down. That's deliberate, because fear-based health advice rarely sustains itself, and an organ that's been quietly absorbing damage for years doesn't need a dramatic, unsustainable overhaul. It needs steady, consistent relief applied honestly over time. You walked in here today thinking this was a conversation about your liver. It was really a conversation about attention, about an organ that has never once asked you for anything, that has simply kept working silently on your behalf for as long as you've been alive. It has never complained. It has never once made you pay attention to it before it absolutely had to. Today, you're finally paying attention on your own terms before it has to force the issue. That's not fear. That's respect for the one organ in your body that's been quietly making everything else possible without ever once asking for thanks. I want to start with a confession that isn't mine. It's yours, whether you realize it or not. For years, you've been trusting the wrong organ to protect itself the way every other part of your body does. You cut yourself, you feel it. You strain a muscle, you feel it. So somewhere along the way, you assumed your liver would do the same thing, that if something were truly wrong, you'd know, you'd feel it, your body would tell you, it won't. And that single quiet assumption may be the most dangerous thing in this room today. Your liver has almost no pain receptors. It can be under real measurable distress, accumulating fat, inflamed, scarring, while you feel completely fine. Go to work, eat dinner, laugh with your kids, feel by every measure available to you perfectly healthy, while one of the most important organs in your body is quietly losing a battle nobody told you it was fighting. And here's what makes this even harder to accept. We were taught to watch one door, sugar, cut the soda, skip the dessert, feel like you'd done the responsible thing and move on. But an entire generation did exactly that, genuinely cleaned up their sugar, and their livers kept struggling anyway, because sugar was never the whole story. It was simply the easiest villain to name, while something else, several somethings in fact, walked quietly past the door we were all watching. In the next few minutes, I'm going to show you what's actually been driving this, the causes almost nobody connects, the assumptions that have kept people from ever thinking to ask, and exactly what you can do, starting today, before your liver ever has to force the issue. This organ has never once asked you for anything. Today, we finally return the favor.